to speak relatively slowly in order that interpretation can keep up with our pace. For our guests, we have a very full program with many moving parts. And so I will invite you at points throughout the meeting to put out your phones and take photos if you wish. But please make sure they're muted, your children, nobody's calling you in the middle of a speech. Also turn off the flash if you have a flash camera. The conveniences are downstairs. If you need to leave the meeting before the end, we do understand this is the WHA and there are many things happening simultaneously. Please either go out by the side or wait until somebody has finished their intervention before you leave us. At the end of the meeting today, there will be opportunities to take photos. We would very much like our distinguished ministerial guests, our co-hosts, and our partners to be featured prominently in official photos. And so at the close of the meeting, we will ask you to please stay with us so we can do some of those photos. For all of our guests, we will continue to take photos throughout, and we will be sure to share them with you. I will take a signal from my colleagues at WHO. We are now ready to start, I believe. Okay. Okay. Your Excellency, Dr. Malaki Manuda, Minister of Health, Republic of Cameroon. Your Excellency, Dr. Abdelmajid Abdelrahim, Minister of Health of the Republic of Chad. Your Excellency, Dr. Ahmed Roble Abdile, Minister of Health, Republic of Djibouti. Mr. de Girmay, the Chargé d'Affaires, Permanent Mission of Eritrea to Geneva. Dr. Messe Hailu, Director General of the Ethiopian Public Health Institute, on behalf of Her Excellency, Dr. Mekdes Fesa, Minister of Health, Ethiopia. Your Excellency, Dr. Adan Duale, Cabinet Secretary, Ministry of Health, Republic of Kenya. Your Excellency, Dr. Ibrahim Assi, Minister of Health of Senegal. Your Excellency, Dr. Ali Haji Abubakar, Minister of Health, Somalia. Your Excellency, Janista Mhagama, Minister of Health, Republic of Tanzania. Your Excellency, Colonel Major Kaaba Hakimi, Minister of Health of Niger. Your Excellency, Margaret Muhanga Mugisa, Minister of State for Health, Republic of Uganda. Your Excellency, Nasoro Mazrui, Minister of Health of Zanzibar. Dr. Godwin Tadom, Director of Public Health, Federal Ministry of Health and Social Welfare, Federal Republic of Nigeria. Dr. Kadiende Chong, Director General, Preventive Health Services, Republic of South Sudan. Excellencies representing the Republic of Sudan. Your Excellency, Dr. Jean Kaseya, Director General, Africa Centers for Disease Control. Professor Julio Rocco Tony Rina, Director of Health and Humanitarian Affairs, African Union Commission, representing Her Excellency Ambassador Amatum Amoa, AU Commissioner for Health, Humanitarian Affairs and Social Development. Dr. Ibrahima Sosa Fall, in your own capacity and representing Dr. Tedros Ghebreyesus, Director General, World Health Organization. Our distinguished co-organizers, our hosts and supporting partners, distinguished delegates, distinguished colleagues, friends, welcome. My name is Spring Gombe, and it is a great honor to serve as Master of Ceremony for this landmark event, accelerating neglected tropical disease elimination through country-driven efforts and cross-border collaboration. We gather here not simply to speak of neglected tropical diseases, but as a testament to the power of perseverance, partnership, and political resolve. The community of practice that you constitute is a proof that tenacity in the face of resource constraints, policy inattention, pandemics, climate shocks, and shifting donor landscapes can yield dividends. At a time when global health faces profound uncertainties, this room offers a compelling counter-narrative, one of progress, resilience, and regional solidarity. We are here to celebrate an especial turning point for neglected tropical disease and for visceral leishmaniasis, a disease that for too long has afflicted the most vulnerable, children, youth, and the rural poor. Today, Eastern Africa and the Horn of Africa stand on the verge of rewriting that story. The signing of an historic memorandum of understanding by 8 affected countries signaled a promising new era of implementation, where cross-border coordination is no longer aspirational, but operational. This is African leadership in action. This is what a true community of practice looks like. Sovereign nations aligning for shared health security with evidence, ambition, and trust. Let me now outline the structure of our program. We will begin with welcome messages from the World Health Organization and the African Union, followed by high-level opening remarks, a ceremonial signing of the Memorandum of Understanding on Visceral Leishmania Elimination, 2 panel discussions on elimination and cross-border collaboration, and finally, the launch of a collective call for action, which will be endorsed live on stage by ministers. It is an ambitious program, and rightly so, because the stakes are high, but so too is the momentum. With that, let us begin, and it is my distinct pleasure to invite Dr. Ibrahima Sosa Fall to make remarks on behalf of the World Health Organization. Dr. Fall.
Thank you very much. Merci beaucoup. Honorable ministers, excellencies, distinguished guests, esteemed colleagues, ladies and gentlemen. It's both a great honor and pleasure, privilege to be with you today on behalf of Dr. Tedros, our Director General, but also on my own capacity as Director of Global NTD Program on this sidelines of the 78th World Health Assembly as we witness a powerful moment of unity and determination. Ministers of health from across regions are coming together to sign a landmark memorandum of understanding to eliminate as public health problem visceral leishmaniasis, one of the deadliest neglected tropical diseases. Alongside this, they are issuing a bold call for action, a shared commitment to cross-border collaboration and accelerated progress towards global disease elimination targets. These commitments are not made in isolation. They build on the momentum of real and ongoing achievements. From 2010 to 2023, we have reduced the number of people requiring NTD intervention by more than 30%. a clear sign of power of sustained global effort. As of now, 56 countries have already eliminated at least one NTDs. You may recall that our target is at least 100 countries by 2030. Milestone to mention are Togo, leading the way with 4 diseases eliminated, while Benin, Ghana, and India have each eliminated 3 diseases. But let me take this occasion to mention something specific about Togo, because everybody was celebrating the elimination of 4 diseases at the same time. But what happened 20 years before? It was my first year in WHO, and we went there while writing the Global Fund proposal for malaria. We included NTDs. So for the first time, they received 11.5 million combining malaria and NTDs. So if you have deliberated effort to integrate disease elimination, this is possible, and we can eliminate so many diseases at the same time. In 2023, around 900 million people received treatment, supported by 11 billion donated treatment since 2012. Now, at the midpoint to 2030, the global community must renew its energy urgency, sustain gains, and invest in surveillance and elimination effort across borders to meet ambitious goals ahead. By 2030, we aim to reduce by 90% the number of people requiring NTD treatment, intervention, and cut NTD-related disability by 75%, and eliminate at least 1 NTD in 100 countries. Let me turn to one of the most challenging yet promising fronts in this fight, visceral leishmaniasis, or Kala-Azar. VL elimination as a public health problem in Eastern Africa region is not easy, but it's possible through concerted effort and sustained implementation of elimination strategies. We have witnessed this in South Asia, where countries like Bangladesh have achieved historic success, becoming the first country to validate the elimination of VL as a public health problem. Inspired by this progress, in 2024, stakeholders launched the strategic framework for visceral leishmaniasis elimination in East Africa, 2023-2030. Building on this momentum, we are here today to celebrate another historic milestone, as 9 Eastern African countries have reached a historic consensus to sign a memorandum of understanding, a formal commitment to regional collaboration. This is more than a health initiative. It is a movement for social justice, equity, and development. In times of financial uncertainty, the leadership and investment of countries at the forefront of this fight against NTDs are more critical than ever. Their unwavering commitment empowers us to craft solutions that are not only cost-effective but also sustainable, ensuring that progress continues even when resources are limited. And this is where integration is a must for all of us. Today, we also come together to mark the launch of a call for action to boost cross-border collaboration, which is not just important, it is essential. As disease knows no borders, neither should our efforts. Only by working together, sharing knowledge, and aligning our strategies can truly reach our elimination targets and build a healthier and more equitable future for all. To accelerate our progress, we must act boldly and decisively. We must scale up what works, integrate our effort across borders, empower communities to lead the change. We must work together with resolve, with unity, and with hope. Let us continue making history together. I thank you.
Thank you very much, Dr. Sosefal. We are in the process of making history, and that can be a bit messy. I understand that our leadership of the African Union is on their way here, not yet here, but we have the distinguished colleague and friend, Dr. Landry Segwe, who's going to make the remarks on behalf of the African Union Commission, and Dr. Kaseya at the Africa CDC.
Good morning, good afternoon. First of all, I would like to mention, I'm making this remark on behalf of Dr. Jean Kasseya, Director of Africa CDC. I believe that Professor Julio, the Director of Health at the African Union, should be on his way. Thank you. So it gives me great privilege and honor to be with you today, Excellency Ministers of Health, Excellency Ambassadors, and to make this remark on behalf of Director General of Africa CDC, Dr. Jean Kasseya. We are here today to witness a critical moment on the global onchocerciasis elimination, a moment where we are celebrating acceleration on NTD elimination through cross-driven effort and cross-border collaborations. Distinguished delegates, partners, and representatives from our member state. On behalf of Africa CDC, I commend the organizers for mobilizing action around the elimination of neglected tropical diseases, which continue to impose a heavy burden on millions of our people. The team, Act Now, Together, aligns with our belief that health security must be collective, coordinated, and cross-border. Africa CDC, the autonomous public health agency of the continent, is advancing a transformative agenda to build stronger, more resilient health systems across the continent. Our strategic plan, which covers the period 2023 and 2027, underscores the importance of integrating and strengthening control programs for communicable and non-communicable diseases. Through our framework, we are committed to supporting integration of NTD control via a multi-sectoral, multi-country coordination mechanism. Our goal is to ensure that disease elimination programs, including those for NTD, are not isolated vertical interventions. Instead, they are fully embedded into primary health care and health security agenda, strengthening not just communities, but the entire health systems. We know that diseases do not stop at borders, and neither should our response. More than 600 million people on our continent remain at risk of at least one of the neglected tropical diseases. In many cases, these diseases cross borders through migration, trade routes, or shared ecosystems, making regional collaboration indispensable. Africa CDC has been working to enhance cross-border surveillance platforms through the Integrated Disease Surveillance and Response Framework in close collaboration with WHO. That framework now, that system now covers almost 90% of our African Union member states. Our community-based and event-based surveillance systems are increasingly inclusive of neglected tropical diseases, such as schistosomiasis, onchocerciasis, lymphatic filariasis, particularly in hard-to-reach populations. The progress in visceral leishmaniasis control in Kenya, Ethiopia, Sudan underscores what is possible when cross-border cooperation is strong, surveillance is efficient, and health services are accessible. An effective disease control strategy is only as strong as the people who are implementing it. Through our public health workforce strategy, we have committed to train by our head of state committed us to recruit and train 2 million community health workers on the continent. As of yesterday, we published a survey, a continental survey of community health workforce on the continent. And we estimate, as of yesterday, that the continent has now achieved 50% of that target. So we still have a way to go to achieve the 2 million target. We believe that these frontline health workers are critical in delivering mass drug administration, promoting health education, conducting surveillance, case finding, especially in border regions and conflict-affected areas. Dear ministers, dear partners, ladies and gentlemen, the journey towards NTD elimination also demands sustainable financing. Yes, at this critical time, these are the programs that are at higher risk of being further undermined. I don't want to say neglected, because, yes, it will be using the word neglected twice, right? I think we are advocates of elimination. And elimination can be politically attractive. But at the same time, we know elimination can be very difficult to make a case because the burden is not the same. Yes, that's the question of the burden of disease versus the investment that is required. So we are challenged to revisit our narrative in front of our ministers of finance, ministers of health. Most of our advocacy will be done through the voice of the ministers of health. How do we make the case of investing on a disease which we wrongly label neglected? I don't want to use that qualifier too much today. These are not neglected. I think people are not neglected. At least our head of state committed to invest, and they committed Africa CDC to disease prevention and disease control. So for Africa CDC, what we call neglected diseases are priority diseases for elimination. But the case today is how do we, in an environment where resources are resources are reduced, and we need to tap into domestic resources. How do we make the case to invest more of our domestic resources on diseases that are not high burden? How do we make the case that elimination is not only the right thing to do when we can achieve it, it's also an economic, it brings highest return on investment because you don't have to care about case management anymore. I think this is an important point of advocacy that I wanted to ensure I communicate today. Because of the 1.4 billion needed annually to eliminate the top 5 entities on our continent, the current funding level is very insufficient. So how do we bridge this gap? We need innovative financing as part of the domestic resources that are needed. But we need also blended financing. And this is where NTD historically has proven to be the agenda that has shown how to work efficiently with the private sector. We need blended capitals. We need more and more foundations to step up at this critical moment for the NTD agenda. So let me end by recommitting Africa CDC leadership to support this coordinated regional and continental effort to eliminate NTDs through cross-border actions and data sharing. We advocate for increased domestic investment and stronger partner support to our member state to achieve the elimination goals. And we also advocate for elevating NTD priorities within the ministerial and the political agenda of the African Union. We will do that thanks to our collective engagement. We do that because NTD is not about the neglected diseases, but it's about the most vulnerable that are waiting for us to take action. And action should be taken now. I thank you.
Thank you. And so we have arrived at the moment for an illustration of this transversal collaboration and integration for one of our priority infectious diseases on the African continent. And we're going to do a bit of ballet among the ministers. So we will ask the Honorable Representative of the Minister of Health of Ethiopia, Dr. Mesehailu, to come and give remarks on behalf of the countries signing the Memoranda of Understanding that you see in front of you. At the same time, we will ask the honorable ministers or their representatives of the republics of Chad, Djibouti, Eritrea, Kenya, Somalia, South Sudan, and Sudan to take a seat at the table up here. If I may invite you to join us. There will be 3 people supporting the signing, and they will move the memoranda of understanding down the table among you. So everyone else, while we're getting ready, get your phones out. This is a big moment. Do not stand. You can hold it above your head, but get your phones out and ready to take photos. Dr. Hailu, if I could invite you to the podium. And ministers, if you could join us, please. Please. Okay. Okay, so as we don't see Dr. Hailu in the room yet, shall we just proceed? Nothing will stop progress. So ministers, we'll invite you to sign. Yep. Everyone open to the signatory page, which is the final page on your document. Cameras ready. Go. Your Excellencies, we thank you. We look forward to a future without visceral leishmaniasis and to our region achieving one of the ambitions of the Sustainable Development Goals in respect of neglected tropical diseases. I think they would like a photo with your copies open, if it's possible. Yeah. Okay, thank you very much again. As we move forward in the celebration of this historic moment, I would like to invite observations and deeper elaborations of successes and milestones, as well as advocacy strategies to reach NTD elimination targets and to mitigate the risk of losing the gains made of the past decades. The next panel will focus on the mitigation of risks, on the gains made and opportunities ahead of us, and will be moderated or facilitated by Dr. Daniel Danye, Unit Head of Prevention, Treatment and Care at the NTD Department at WHO. Dr. Danye, if I could ask you and the panelists, Honorable Abderrahim, Minister of Health of Chad, Honorable Duale, Minister of Health of Kenya, and Honorable Awadallah, Minister of Health of Sudan, if they are here or if their representative is here, and Dr. Luis Pizarro of DNDi to please take your seats and lead the discussion. Do you want the podium? Sit with people on either side of you. They're all coming up with you. Why don't you ask them to come to the mic? Do you want a table mic? Okay. Can I move this to the table? We're just awaiting Dr. Sultani Matendechero to join us from Kenya on behalf of the Minister.
So we can go ahead. Okay, he was here, huh? Chad. Chad. Yeah. I think, I don't know if that's right. Okay. Yeah. Thank you. So we'll proceed to the next session. This is basically really a historical moment. It marks a long-awaited historical day for the elimination of visceral leishmania in Africa region. We believe that signing of memorandum of understanding committing through MOUs really is a base and an important ingredient to show, not only to show and demonstrate commitment, but also to demonstrate accountability in moving forward in the achievement of disease elimination and eradication. Why some people were asking me why memorandum of understanding for visceral leishmaniasis elimination. So I just wanted to quickly remind why we really need visceral leishmaniasis elimination memorandum of understanding in this sub-region. Visceral leishmaniasis is characterized by a recurrent epidemics in the Eastern Africa, in the sub-region. In the period between 1980s to 1990, in Eastern Sudan and parts of Ethiopia, witnessed large surges of visceral leishmaniasis cases. These major epidemics or outbreaks that ran for over 10 years caused 100,000 deaths only in the western upper Nile region of Sudan, the then Sudan, now South Sudan. So And then following that, small-scale epidemics and outbreaks of visceral leishmaniasis are occurring in the past 20 years, 2 decades or 3 decades. However, due to improved access to treatment, early diagnosis, and better management, better treatment, the mortality rate and the case fatality rate from visceral leishmaniasis in this sub-region has come down. However, taking the lessons from Southeast Asia region that has moved further after signing the first Memorandum of Understanding in 2005, we've been advocating for the Eastern Africa nations to come and commit themselves by signing a Memorandum of Understanding to end this deadly disease. Now, today is the day. So with this remark, I will call my honorable ministers and representatives to address us with few questions. I will start with Chad, the Minister of Chad. Honorable Minister, would like to hear your experience on elimination of neglected tropical diseases and also the progress and challenges on visceral leishmaniasis elimination in your country. Thank you. Over to you.
Merci beaucoup, Monsieur le Ministre, Monsieur le représentant de l'OMS, distingués invités, Mesdames et Messieurs. Moi, je pense que ça, c'est une très bonne occasion pour discuter non seulement de l'élimination de la leishmaniose, mais également du renforcement des systèmes de santé. Eh bien, le Tchad, à travers son plan national de développement sanitaire, coordonne toutes les interventions avec les communautés. Le succès de notre réussite, c'est l'implication des communautés dans la cogestion des systèmes de santé, de la planification jusqu'à la mise en œuvre. On ne peut pas bâtir un système de santé résilient, efficace, sans les bénéficiaires. Deuxième élément, c'est les chefferies traditionnelles. Mais surtout, la synchronisation des interventions avec les pays. J'insiste beaucoup sur cette dynamique commune. Je pense très honnêtement que nous devons collaborer et engager des actions transfrontalières. Parce que de part et d'autre, il y a des mouvements de population. Et nous sommes obligés de comprendre que la promiscuité, le surpeuplement, le déplacement de la population est un facteur aggravant de la flambée des maladies. Le premier cas de leishmaniose a été identifié au Tchad en 2020, surtout à l'extrême nord du Tchad, vers la frontière avec la Libye. Il y a 2 provinces qui sont devenues des provinces endémiques. Ceux qui connaissent le Tchad, c'est le Tibesti et le Borkou. Actuellement, nous avons identifié, si je ne me trompe pas, 171 cas qui sont notifiés. Mais grâce à la coordination des interventions avec l'OMS, nous avons pu disponibiliser des ressources humaines, matérielles, mais surtout des médicaments. La leishmaniose viscérale, c'est la forme la plus dangereuse, je dirais même mortelle à l'absence de traitement, qui touche la plupart des populations, surtout les pauvres qui sont exposés à des vulnérabilités accrues. Ceux qui connaissent le Tchad est un pays vaste, diversifié. Mais nous avons une population spécifique, les nomades transhumants, qui ne vivent que de leur cheptel animal. Donc nous avons adopté une approche unique, ce qu'on appelle la santé unique, l'approche One Health, parce que maintenant il y a une très forte complicité entre les maladies d'origine zoonotique et les maladies d'origine humaine. Donc nous travaillons avec les éleveurs en faisant des stratégies avancées et mobiles, parce qu'ils sont en perpétuel mouvement à la recherche des zones de pâturage. Donc nous avons appris avec les cliniques mobiles et on a formé des instances de gouvernance communautaire qui co-gèrent le système de santé avec nous. Donc voilà les principales stratégies. Et il contribue également pour la détection des cas actifs et passifs. Mais l'intérêt actuellement, c'est de renforcer la surveillance épidémiologique et surtout la synchronisation des interventions avec les États voisins. Et je crois que ça, c'est la signature de cet accord extrêmement important, de ce mémorandum. Et j'invite tous mes collaborateurs des pays endémiques pour dire que les maladies tropicales négligées, surtout la leishmaniose, elle constitue la leishmaniose viscérale. Elle est une priorité de priorité parce qu'elle est une maladie tropicale la plus négligée des maladies négligées. Donc nous devons s'asseoir ensemble et continuer à lutter ensemble pour l'élimination de cette maladie. Merci beaucoup.
Thank you, Honorable Minister. Now I move to Sudan. Sudan is one of the countries in the region with the largest number of visceral leishmaniasis cases, with frequent and recurrent epidemics for so many years. And a lot of research has also been done in Sudan. Now we know the situation in Sudan. Sudan is affected by conflict. However, the program, the Ministry of Health is trying its best to access and treat the cases. So we would like to hear from you the progress and the challenges on the elimination program for visceral leishmaniasis and other NTDs.
Thank you, Moderator, for the opportunity, and Your Excellencies, distinguished colleague. I have the honor to speak on behalf of His Excellency Dr. Haitham on this very important, I think it's a very great juncture for visceral leishmaniasis elimination. And as you know that Sudan is facing one of the biggest humanitarian crises in the world, with 8 million people forced to flee their homes, health facilities compromised, supply chain compromised, and the health infrastructure is severely damaged, with health workforce also relocate to another states or left the country. Before the conflict, Sudan operating 44 Kal-Azar diagnostic and treatment centers in 12 states. Today, only 21 diagnostic and treatment centers are functioning, and in only 7 states. That means many marginalized and vulnerable patients are left without care. Unfortunately, the health workforce are unable to reach those affected, and supply chain and diagnostic and treatment broken repeatedly, resulting in treatment delays, incomplete case management, and this result in rise in the burden of post-Kal-Azar dermal leishmaniasis. And now Sudan, one of the highest country in the eastern region. And the displacement also of the population reshaped the epidemiological landscape. Areas, those were endemic previously, now placing pressure, displaced patients from those areas, pressing the pressure on the accessible states, and many of these displaced communities settled in places where the vector breeding sites, and people have very limited, or I could say absent, vector control intervention, and it's also further complicate the surveillance and case management capabilities. And amid these profound challenges, we have witnessed extraordinary resilience of our national program for neglected tropical disease, with our partners, especially WHO, the END Fund, MSF, Oriol, and etc. Most of them, they are trying to sustain the service. They are doing that like adapting the existing system capabilities and to adapt the strategy to do redistribution of stock, rapid deployment of the mobile teams, and coordination among the states to ensure that displaced patients receive appropriate care in other states. And this effort demonstrates our commitment and underscore the importance of strong partnership. Also, one of the big achievements for us now is the first ever community health system strategy. We have developed and localized to align with all our national strategies for non-communicable diseases and neglected tropical diseases. However, we look forward to our partners to support the implementation of those strategies. Sudan affirms its commitment to the regional goal of the visceral leishmaniasis elimination as a public health problem. However, achieving this requires adapted conflict-aware strategies. We need to remap our prioritize accessible areas, which is still having the 85% of the national burden. Also, we are looking to ensure at least one functional facility per each locality in the Sudan, and to strengthen our community engagement through community health workers for detection and referral, and also to decentralize the logistics, and also to invest in the cross-border cooperation and integrated approach to integrate the VL intervention within the broader NTDs and PHC, and also to include it in the humanitarian health responses. And I think also Sudan continued to treat patients from neighboring countries, which create a double burden for the already fatigued system. And we hope that WHO and the partners continue their effort to advocate with the drugs manufacturers, especially Ambisom, to ensure continuity of the supply and treatment. And I think this today signature, the MOU among countries, it's a real milestone. It reflects not only our technical ambitions, but also shared humanity for our duty for our population. And thank you so much for the opportunity. And on behalf of the Sudanese people and health workforce, I thank all of our partners, those standing with us in these very difficult times. Thank you, and over to you.
Thank you, Dr. Dalia El Taib. On behalf of the Minister of Health of Sudan, we'll be with you. We'll continue our support on behalf of WHO, the African Union, and all the partners represented here. We understand the situation you are in, and we'll continue our support. Now we move to Ethiopia. Dr. Masai Hailu Masai, on behalf of the Minister of Health of Ethiopia, Dr. Magdas Daba, he will make a brief remark.
Thank you very much, Excellencies, Honorable Ministers, distinguished representatives from African Union, WHO, development partners, and the global health community. It's a great honor to address you on behalf of the Federal Democratic Republic of Ethiopia on this historic moment, representing our Minister, Her Excellency Dr. Magdas Daba. So on the signing of the Memorandum of Understanding to eliminate visceral leishmaniasis as a public health problem by 2030. VL remains one of the deadliest neglected tropical diseases in our region, threatening more than 74 million people and taking over 100,000 lives in the last 4 decades. Each year, around 30,000 new cases occur, primarily affecting the poorest, the displaced, and our children. But visceral leishmaniasis is not unbeatable. We are proven tools and effective strategies, early diagnosis and treatment, vector control, disease surveillance, and community mobilization. What we need now is political resolve, strong partnership, and coordinated regional action.
The memorandum of understanding aligned with the WHO and NTD roadmap and the Eastern African VL elimination framework reflects our united commitment. It sets clear pathway for collaboration on resource mobilization, cross-border coordination, research, innovation, and intersectoral efforts. While non-binding financially, it creates a vital platform for technical and financial support from international partners. Ethiopia was honored to host the regional VL framework launch in June 2024, and the request the African Union's leadership in today's signing. Our collective regional targets are ambitious but achievable. To reduce case fatality to below 1%, cut new cases by 90%, and ensure 90% of cases are treated within 30 days, and reach zero child deaths from visceral leishmaniasis. On behalf of our Minister, I call on donors, foundations, and global health actors to join us. Eliminating visceral leishmaniasis is not just feasible, it's a moral, public health and economic imperative. Let this agreement be a symbol of African solidarity and global partnership in action. Thank you.
Thank you, Dr. Hailu. Thank you. So now we will move to the last part of this session. So the next speaker is not a minister, but a major partner, really the pioneer and the forefront runner in developing drugs for neglected diseases. The Drugs for Neglected Disease Initiative CEO, Dr. Luis Pizarro, is with us. So, Luis, I have one question for you that you can probably summarize in 3-4 minutes. As a major R&D organization, we would like to hear from you, what are the key ingredients for success for elimination?
Thank you, Daniel. Honorable ministers, dear colleagues, dear friends. It's of course an honor for me and for the NDI to be invited today to this event and be with you. Because, first of all, we acknowledge the strong political commitment you are all doing around this document, this treaty. It's not just, I would say, a piece of paper you are signing today. It's a real political act that will not only contribute to eliminate visceral leishmaniasis, but we hope that will also strengthen the research and development capacities in the region, and that will bring this scientific community to work together. To be more precise on your question, Daniel, I think we all know that today the treatments for visceral leishmaniasis are not ideal. They are sometimes toxic, they can be painful for the patients, and they are also costly for all of you ministers who need to be behind that. And this is particularly difficult for the people who are living in rural areas, in remote places that has to cope with this very difficult situation. At the NDI, we think in 2025, when you look at the progress of science, what we were able to do during the COVID pandemic, this is not acceptable. And it's very, very important that we are all together mobilized to do that a reality. And it's not acceptable because R&D cannot be a luxury. And is what you see here when you talk about the NDI is we believe that it's possible to bring the best science for the most neglected people, most neglected communities. It's also an investment because, of course, it costs money. But this money will be invested for the populations because when they are healthy, it's the whole country that will benefit from that. And it's an investment for health systems. You are all very concerned to strengthen your health system, and investing in research and development being able to eliminate visceral leishmaniasis is a very, very important way to have a stronger public health in all of your countries. I think the last message maybe, and it's somebody like me coming from another continent, South America, I am from Chile, but working with you in Africa since now almost 20 years, I started in Niger, as I said to the minister, long time ago, is that this is possible with African leaders as you, African scientists, African doctors that are making this elimination a possibility. And we are not looking for scientists here in Europe or in the US or etc. to fix and to solve the problem we have in our continents. We are being able to mobilize our own resources to be able to succeed this objective. And I think this is really key on the success we're looking for, and I strongly commit the whole DNDi team who is working on that to stand with you and to ensure that all together we're able to eliminate visceral leishmaniasis in the continent. Thank you very much.
Thank you, Luis. Thank you, Luis. Thank you, Luis. So as we conclude this session, the signing of this historical memorandum of understanding, it shows that countries publicly committed and accountable to take significant measures to reinvigorate all efforts, including policy prioritization, resource mobilization, and resource sharing, a scaling up of existing and innovative interventions in all endemic areas towards the achievement of visceral leishmaniasis elimination. It's not the end, but the beginning of the long and arduous journey. Thank you so much. Thank you.
Thank you all. That first set of reflections on the elimination challenge and also the elimination opportunities will be followed now by a discussion on other mechanisms for cross-border collaboration and other initiatives that have been undertaken, notably for onchocerciasis. Chairing the panel will be Professor Julio Rakotonirina, Director for Health and Humanitarian Affairs at the AU Commission, and he will be joined by Dr. C, Minister of Health of Senegal, Honorable Magama, Minister of Health of the United Republic of Tanzania, Dr. Solomon Zewdu, as CEO of the End Fund, and Alison Goldberg, President of the Merck Foundation. If I could invite you all to join us at the front of the room. Dr. Julio, I think you will also be making your own remarks and reflection on of this memorable occasion. So I hand over to you now. Thank you.
Thank you so much, and please also give to our honorable ministers, our panelists, the tool, because I will manage our panel in French, please. I will speak in French, please. Merci beaucoup. Tout d'abord, Excellences, Mesdames et Messieurs, tout protocole observé. Tout d'abord, je voudrais vous transmettre les meilleures salutations de Son Excellence, ambassadeur Ama, qui est la commissaire en charge de la santé, Affaires humanitaires et développement social. Elle m'a chargé de la représenter durant cette réunion. Honorables et Excellences, Mesdames et Messieurs, il est impératif que les maladies tropicales négligées soient placées au cœur des priorités sanitaires nationales. La feuille de route entièrement chiffrée de l'Union africaine à l'horizon 2063 et au-delà constitue un cadre de référence essentiel pour guider nos efforts. Elle définit les objectifs clés tels que la mobilisation accrue des ressources nationales, l'accès universel aux interventions sanitaires essentielles et le renforcement de la coopération transfrontalière. Désolé. Aujourd'hui marque une étape importante de notre engagement, la signature du MOU par les pays d'Afrique de l'Est. Permettez-moi donc de vous inviter à vous engager autour des 3 actions prioritaires: célébrer nos progrès, mobiliser les financements durables et autonomiser les communautés. Passons donc à notre panel. Nous aurons effectivement pour le moment 3 panélistes. Permettez-moi de commencer par son Excellence, ministre en charge de la Santé de la République unie de la Tanzanie. La question est comme ceci: comment la collaboration transfrontalière dans l'élimination des maladies tropicales négligées peut-elle servir de catalyseur pour un renforcement plus large des systèmes de santé, et quelle est la contribution de la Tanzanie à travers le partage d'expériences et le partenariat régionaux?
Thank you very much, Moderator. Before responding to the questions which you have given them to me, let me start by thank GON, the African Union Commission, the END Fund, and the NDI for organizing this very important gathering and providing Tanzania as one among the lead member states to participate in this important side event at the 70th World Health Assembly. Today's event, aligned with the WHO's global targets and the Sustainable Development Goals, Tanzania is committed to these goals, and we recognize the cross-border collaborations as an essential to achieving the goals. Tanzania shared borders with Kenya, Uganda, Rwanda, Burundi, Democratic Republic of Congo, Zambia, Malawi, and Mozambique. We have experienced some challenges for coordinating NTD control efforts across these borders. For example, trachoma control is complicated by population movement across our border with Kenya, and alcohol elimination in the south part of Tanzania requires joint action in a river basis shared with Mozambique. This all requires synchronized interventions. We understand the risk of diseases, reintroductions from neighboring countries, and the need for robust mechanisms to prevent this from happening. This is not just a health issue, but also a matter of economic stability and development. Strong cross-border collaboration is not only vital for NTD eliminations, but also strengthen health system and enhance our capacity to tackle other infectious diseases. This is a valuable point that needs to be emphasized. Tanzania is willing to share its experiences and the best practices in NTD's control within neighboring countries. We believe that opening communications and the knowledge exchange are crucial for effective collaboration. We also believe in strengthening regional coordination mechanisms for facilitate cross-border activities, such as joint planning, surveillance, and the implementation of interventions. We are honored that organizers of this event have recognized Tanzania's leadership in the fight against NTDs. We take this recognition seriously, and we are committed to playing an active role in promoting cross-border collaboration, and we are very much happy Tanzania have a chance to be a first chair, an outgoing chair of GON. So this is impressed. And I have the outgoing chair, Dr. Clara. She's here with us here in the conference. So we are very much appreciating the way he chaired GON for some several couple of months. We are believing in strengthening regional coordination, as I have said, but we are honored that the organizers of this event recognize Tanzania, but also recognize the work which have been done by the outgoing chair. Collaboration is not an optional; it's the only way. It is the only way to come out from this problem. It is strengthening health system across the border. Today, I'm pleased to announce Tanzania's commitment to working on a memorandum of understanding on a cross-border collaboration for NTDs. This MOU will serve as a framework for cooperation with our neighboring countries, enabling us to pool resources, share knowledge, and coordinate efforts to eliminate NTDs from our region. Today, Tanzania reiterates its call for enhanced cross-border collaboration. We urge all endemic countries to prioritize joint planning, resource mobilization, and the program implementation. We invite partners to increase their support for cross-border initiative, both technically and financially. We must hold each other, be accountable. We have to track our progresses and adopt our strategies which needed. Tanzania is committed to working together with all partners. Let us turn our words into actions. There is no more time for words, but we still have time for actions. The time to act is now. Together we can eliminate NTDs and leave no one behind us. Thank you very much for listening.
Merci infiniment, Madame la Ministre, de nous avoir donné donc une vue vraiment très pertinente par rapport à la lutte contre les maladies tropicales négligées. En Tanzanie, vous avez surtout insisté sur l'intérêt d'avoir un mécanisme robuste de santé à la frontière. Et vous avez également évoqué votre enthousiasme d'aider les autres pays dans la lutte contre les maladies tropicales négligées. Mais maintenant, permettez-moi de donner la parole au docteur Solomon Zeoudou, qui est directeur général du Endfond. En fait, Endfond a joué un rôle incroyable dans l'avancement des efforts visant à éliminer les maladies tropicales négligées. Pourriez-vous, Monsieur le directeur général, nous faire part de quelques clés par lesquelles Endfond a contribué à accélérer les progrès en matière de collaboration transfrontalière en particulier par le biais de programmes nationaux et régionaux.
Merci. Thank you, moderator. Honorable ministers, distinguished guests, and ladies and gentlemen, this is an honor to be here, and I'll make my comments very brief for the interest of time, and because we're celebrating the countries today, not necessarily the role of NFUN, but we actually are very honored to be part of this momentous event in celebrating what we continue to aspire for. One word that comes to mind again or one term for the End Fund is really being laser focused on supporting countries. And today, and days like this and events like this, and ministers signing a country-driven effort, a cross-border collaboration, really puts us on the path of appreciating that all the efforts that we put alongside all of the partners, one sitting to my right, few in the audience as well, that we are on the right track. Country ownership for us is the #1 driver of success. Therefore, this is a really amazing opportunity for all of us to come together here to recognize country efforts in the elimination of these diseases. We talk about VL today, but absolutely there's a lot more that we can do with this kind of collaboration. We leverage opportunities. We leverage opportunities such as drug donations. We leverage opportunities such as, other collaborative opportunities like the one with the NDI here. And our work wouldn't be able to be successful unless we have the opportunity to really come together as a community. And at the center of that community is the countries. And again, to reiterate the fact that this is a huge, exciting moment for the End Fund to be able to really come forward and appreciate what has happened today, recognize it for the great moment that it is, and really, without any additional comments, applaud today's effort, all the efforts that has gone into it, and congratulate the community in really making sure that we address this in its entirety. So thank you for the opportunity, and I appreciate the moment. Thank you.
Merci infiniment, Monsieur le Directeur Général, de nous avoir encouragés à avancer beaucoup plus, puisque c'est un mot qui me semble vraiment très important, non seulement pour nous tous ici, mais surtout pour nos collègues qui sont sur terrain. Maintenant, je voudrais inviter Madame Alison Goldberg, directeur exécutive du Global Impact Giving, Social Impact and Sustainability. La question est ceci. Le don d'ivermectine représente le don de médicaments le plus remarquable de l'histoire et probablement aussi le plus important. Comment ce programme a-t-il contribué à améliorer la collaboration transfrontalière, notamment en garantissant l'accès aux médicaments essentiels et en renforçant les efforts régionaux en vue de l'élimination des maladies tropicales négligées? Vous avez la parole.
Thank you, Chair, and thanks to all of you for including us in this historic milestone. What an incredible moment for neglected tropical diseases and moving us, continuing forward towards elimination. 38 years ago, MSD made also a historic commitment. It made the commitment that it would donate Mectizan as much as needed for as long as needed towards the elimination of onchocerciasis, and then fast forward a few years later towards the elimination of lymphatic filariasis. And when that commitment was made, elimination felt far off. But we're now celebrating the achievements of many countries that are earning, through WHO verification, that status of elimination. Thinking about Niger, who's also in the room today, and that major achievement that was announced on World Neglected Tropical Disease Day for being the first country in Africa to achieve elimination of onchocerciasis. And all of this was made possible because of in-country leadership, persistence, engagement, and partnership. So thanks to all of you for your leadership in making this all possible. So the question was, how have we actually brought to bear cross-border collaboration through our commitments through the supply of Mectazan? And we've done that in 3 ways that I wanted to share, hopefully as insightful for future practice. One is we facilitate the participation of program managers in national onchocerciasis elimination meetings in neighboring countries. That's a very important part of how we support cross-border collaboration. The other thing that we do is we coordinate the supply of Mectazan so that treatment is uninterrupted across regions. And to give just one more example, we leverage the Mectazan Expert Committee, which is a forum, an important part of this partnership model to make elimination possible, to actually address regional priorities, including cross-border strategies with partners who can not only think about them, but actually put those into action. So we are very proud at MSD to be standing alongside many of you in the room, national programs, the WHO, the leadership of GON, and many of the implementing partners, including the NFund, who's near me, and leadership from ministries of health, including Tanzania, as we move closer towards achieving elimination. We're so proud to be on this journey with each of you, and count on us that we remain committed to donating Mectazan to ensure progress is sustained until onchocerciasis and lymphatic filariasis are eliminated. So congratulations on this major milestone and future commitment towards the elimination of visceral leishmaniasis. Thank you.
Au nom de la Commission de l'Union africaine, je voudrais adresser les vifs remerciements à vous, honorables ministres, à vous, les chefs de délégation, à vous, les partenaires, y compris l'OMS, NTD, NFund, et surtout à nos agents de santé en première ligne, dont les efforts inlassables sont la clé de notre succès. Et je voudrais également remercier tous les orateurs pour leurs précieuses contributions et les réalisations impressionnantes qu'ils ont partagées avec nous. Merci.
Excellences, distingués délégués, chers collègues, nous arrivons maintenant à un deuxième moment fort de cet événement, le lancement officiel de l'appel à l'action pour une collaboration transfrontalière en vue de l'élimination des maladies tropicales négligées. Cet appel symbolise un engagement collectif renouvelé en faveur d'une coopération au-delà des frontières nationales et soulignant l'importance d'efforts portés par les pays eux-mêmes, de la solidarité régionale et d'une coordination efficace pour atteindre nos objectifs communs. Je vous invite dès maintenant à préparer vos appareils photo et caméras. C'est un moment à capturer. Nous avons l'honneur et le privilège d'accueillir des dirigeants des pays qui ont démontré un engagement fort et une véritable coopération transfrontalière. Son Excellence Manouda, ministre de la Santé publique de la République de Cameroun. Son Excellence Hakimi, ministre de la Santé publique, de la Population et des Affaires sociales de la République du Niger et représentant la République fédérale du Nigeria, le Dr Tadom, directeur de la Santé publique au ministère fédéral de la Santé et de la Protection sociale, qui s'exprimera au nom de son Excellence, le Dr Mohamed Ali Paté, ministre coordinateur de la Santé et de la Protection sociale de Nigeria. Excellence, c'est à vous. And now we will just hear some short remarks from the ministers to celebrate this call to action.
Mesdames et Messieurs les ministres, directeurs, leaders mondiaux de la santé, distingués invités, je voudrais tout d'abord remercier tous les organisateurs pour l'honneur que vous nous faites en invitant le Niger à travers ma modeste personne pour échanger sur la thématique. Le Niger célèbre une étape historique dans l'histoire des avancées sanitaires mondiales en Afrique. En janvier 2025, il est le premier pays africain à être déclaré exempt d'onchocercose après avoir lutté contre l'onchocercose pendant 50 ans. À mesure que le pays progresse, il est crucial de maintenir une surveillance rigoureuse afin d'éviter toute résurgence de la transmission. Ceci est particulièrement important dans les régions limitrophes des zones d'endémie de l'onchocercose. Après l'élimination de la transmission de l'onchocercose, l'Organisation mondiale de la santé recommande aux pays une surveillance post-élimination jusqu'à l'arrêt de la transmission de la maladie dans les pays voisins pour éviter toute recrudescence de la maladie. La collaboration transfrontalière est essentielle à une prévention efficace des maladies tropicales négligées au Niger, compte tenu de l'interdépendance de la sécurité sanitaire de la région. Le Niger partage des frontières avec plusieurs pays, dont le Bénin, le Burkina Faso, le Mali, le Nigeria, le Tchad, ce qui le rend vulnérable à la propagation des maladies infectieuses. Pour qu'un pays puisse vérifier l'élimination de la transmission de l'onchocercose, il doit également démontrer qu'une collaboration transfrontalière a été mise en place et a permis d'éliminer les foyers de transmission transfrontaliers. Par conséquent, une collaboration transfrontalière bien gérée est essentielle pour prévenir la recrudescence ou la réinfection dans les zones où l'interruption et l'élimination de la transmission a été obtenue. Cette surveillance s'impose à cause des grandes frontières que nous partageons avec des pays comme le Nigeria, sur plus de 1700 km. En ce qui concerne les recommandations de l'OMS relatives à la surveillance post-élimination de l'onchocercose, le Niger avait déjà initié bien avant la déclaration officielle de cette élimination une stratégie de surveillance. Le Niger s'engage dans une coopération transfrontalière guidée par la Convention de l'Union africaine afin de renforcer la surveillance des maladies. Le Niger travaille également sur un protocole d'accord spécial pour la collaboration transfrontalière de l'élimination de l'onchocercose avec le Mali, le Burkina Faso et le Nigeria, qui sera approuvé une fois approuvé pour toutes les autorités concernées. J'appelle mes collègues ministres à soutenir l'appel à l'action et prendre les mesures nécessaires pour atteindre l'objectif commun d'élimination des MTN en élaborant et en approuvant les protocoles d'accord conjoints couvrant les domaines tels que la planification, les interventions et la surveillance conjointe. Les maladies ne s'arrêtent pas aux frontières et notre engagement à les combattre ne devrait pas non plus s'arrêter. Pour terminer, je voudrais adresser toute ma gratitude à tous les partenaires qui nous ont appuyés pour la réalisation des jalons et les progrès atteints. Mesdames, Messieurs, je vous remercie.
I'd like to invite Madame the Director General of Disease Control of Cameroon to make her remarks on behalf of the Minister.
Mesdames et Messieurs, distingués invités, je prends la parole au nom de Dr Manaouda Malachi, le ministre de la Santé publique du Cameroun. Permettez-moi tout d'abord de remercier le Réseau mondial pour l'élimination de l'onchocercose, la Commission de l'Union africaine, le Fonds Inde, la DNDi et les États membres co-leaders pour l'organisation de cet important événement. Le Cameroun a réalisé des progrès remarquables dans la lutte contre ces maladies grâce à des partenariats stratégiques et des initiatives collaboratives. Grâce à ces dernières, notre pays a conduit avec succès les traitements de masse contre la filariose lymphatique et le trachome, avec comme principal aboutissement des évaluations post-administration concluantes sur les 3 dernières années. Dès lors, plus de 12 millions de nos compatriotes ne nécessitent plus de prise de médicaments pour le contrôle de ces 2 maladies. Le Cameroun s'est activement engagé dans une collaboration transfrontalière, reconnaissant qu'une approche unifiée est essentielle pour une lutte efficace contre la maladie et son élimination. Le Cameroun s'est déjà engagé dans une collaboration transfrontalière avec le Tchad dans le cadre de l'interruption de la transmission de la maladie du ver de Guinée et travaille avec le Nigeria, mais aussi avec le Tchad pour pouvoir construire ce type de collaboration dans le cadre de l'élimination de l'onchocercose et du trachome. Ce type d'accord permettra à coup sûr de partager les meilleures pratiques d'atteindre les populations parfois difficiles d'atteindre du fait de leur grande mobilité et surtout de mobiliser de nouveaux financements pour une couverture géographique optimale des interventions. Les maladies ne connaissent pas de frontières et nos efforts pour les éliminer ne devraient pas en connaître non plus. C'est donc un honneur pour nous de nous lancer aujourd'hui cet important appel à l'action, exhortant les États membres de l'OMS, les agences régionales et multilatérales, de même que les partenaires internationaux au développement, à s'engager dans quelques mesures, notamment en direction de nous tous, États membres endémiques de ces maladies. Reconnaître l'objectif commun d'éliminer les MTN au-delà des frontières, s'engager à coordonner efficacement les efforts et les ressources pour les mesures de prévention et de contrôle par une bonne planification et des interventions conjointes transfrontalières. S'engager à un partage des données utiles à la prise de décision opérationnelle de part et d'autre de nos frontières communes. En direction des agences régionales et multilatérales et les autres partenaires qui nous accompagnent, il faudrait soutenir le plaidoyer en faveur d'un financement accru des activités transfrontalières, contribuer à l'élaboration et à la gestion des initiatives transfrontalières, fournir un soutien technique et financier en faveur de ces interventions, accompagner la mise en place des plateformes de partage d'informations permettant d'adapter les activités aux changements épidémiologiques et écosystémiques de part et d'autre les frontières. Accompagner également l'utilisation des technologies innovantes pour la gestion transfrontalière. Alors que nous nous engageons dans cette démarche de collaboration, j'appelle toutes les parties prenantes, gouvernements, organisations internationales, sociétés civiles et secteur privé, à se joindre à nous dans cette entreprise. Ensemble, nous pouvons créer un avenir où les MTN ne seront plus un fardeau pour nos populations et pour nos économies. La lutte contre les maladies tropicales négligées est une responsabilité collective qui transcende les frontières. Les efforts de collaboration transfrontalière du Cameroun, en l'occurrence avec le Tchad, dans le cadre de l'éradication du ver de Guinée, peuvent servir aux autres sous-régions, démontrant que grâce à l'unité et la coopération, nous pouvons surmonter les défis posés par ces maladies et bâtir un avenir plus sain et plus prospère pour nos peuples frères. Vive la coopération internationale. Ensemble, nous pouvons éliminer les MTN et atteindre notre objectif commun. Je vous remercie.
Thank you. A final remark to be made by Dr. Gordon Tadom on behalf of Dr. Mohammed Ali Pate, Federal Minister of Health of Nigeria. Thank you.
Thank you very much, moderator. The coordinating minister sends his sincere apologies for not being able to come because of some engagements, but he has asked me to deliver this message on his behalf. Distinguished guests, esteemed colleagues, ladies and gentlemen, good afternoon. Allow me to express my sincere appreciation to the organizers for convening this significant event. I'm particularly grateful for the opportunity granted to the federal government of Nigeria to be one of the leading member states contributing to these important side events. Of the 21 WHO prioritized NTDs, Nigeria prioritizes 16. These diseases most affect those in our undeserved and underserved communities. The cost of care for the affected population is proportionally steep, about $1 billion USD annually, especially for Nigeria that bears about 25% of the global NTD burden. We recognize that we do not live in isolation, and the risk of cross-border transmission, which can reverse the progress we have made, is significant, especially when neighboring countries are equally endemic. Vectors, as we know, have unrestricted capacities to cross borders, highlighting the necessity for us to collaborate and harmonize programs implementation across our borders. Nigeria shares extensive borders with the Republic of Benin, Cameroon, Niger Republic, and Chad, making cross-border transmission a real concern for us. 67 of our 774 local government areas share boundaries with neighboring countries. I'm here today because I believe in the power of collaborative efforts, not only in addressing cross-border transmission challenges, but also in integrating strategies and securing funding for activities related to NTDs. It is with great honor to reaffirm Nigeria's unwavering commitment to regional health cooperation. I am pleased to announce that Nigeria is undertaking the development of a joint memorandum of understanding focused on cross-border collaboration in the fight against NTDs, which will serve as a foundational framework for cooperation with our neighboring countries. Through it, we aim to collectively mobilize resources, share critical knowledge and expertise, and coordinate our strategies and actions. Our shared goal is clear: to eliminate NTDs from our region and ensure a healthier future for all our communities. On behalf of the government of Nigeria, I would like to say that we are committed to enhancing these cross-border efforts to beat the challenges of NTDs, and I will do my best to ensure that the necessary actions and strategies are put in place to make that happen. Together with my fellow ministers from Cameroon, Niger, I invite all endemic WHO states to endorse this call for action to foster cross-border collaboration against neglected tropical diseases to accelerate elimination targets. I sincerely want to thank the Africa Union Commission, GON, the End Fund, DNDI, and the co-hosting member states to have made this meeting possible today. Thank you, and thank you for listening.
Thank you very much for your remarks. Distinguished guests, we've come to the end of our program, and the skies have opened to bless us, because in Africa, rain is understood as a blessing. And so as we invite you to go get your baptism and then lunch, please follow our colleagues at the back of the room who will show you where lunch is being held. Ministers, if I could please ask you to remain for some ceremonial photos together with the leadership of GON. We won't take very much of your time. Leadership of WHO and AU, of course. Please just join us up here. We'll take a few photos and then we will feed you. Thank you all for being here with us today. It was a wonderful occasion.